te atakura, he teo, he huka, he hauhu, ihei, mauri ora. Ngā mihi mana hau kia koutou katoa kua hui hui mai nei. Ko te mihi tuatahi, ko ranginui e tū iho nei, ko papa tuanuku e tākoto nei, tēnā korua. Ko te mihi tuarua, tēnā koutou i o koutou tinimate, ngā mate, haere, haere, haere. Ko te mihi tuatoru ki ngā kai kōrero mō rātou whakaaro o tēnei pō. Ngau mai haere mai ki tēnei kaupapa, te kaupapa o OraTaiao me te kaupapa o te tangata. E hara ahau I te tangata mōhio ki te kōrero, otira e tika ana ka mihi atu. Ko au he uri ahau ko Ngāti Maniapoto, e noho ana au ki te papaoia, ko kaimahi au ki Climate Health Aotearoa me te ngāpai o te māramatanga, ko kaimahi ki OraTaiao NZ Climate and Health Council. Ko Samarangi Māori e right tōku ingoa. Nō reira, tēnā koutou, tēnā tātou katoa. Welcome everyone to this webinar. My name is Summer. I am one of the co-conveners of OraTaiao New Zealand Climate and Health Council, along with Dr Dermot Coffey. OraTaiao is hosting this webinar in association with Aotearoa Health Workers for Palestine. And tonight we're going to be having a kōrero on Palestine, health workers, climate, and interconnected liberation. We're really delighted to be hearing from three speakers tonight, Dr Ruba Harfeil, Dr Donna Cormack, and Dr Arama Rata. Each speaker will be sharing their own perspectives across the topics of Palestine, health, climate, and justice. And a little bit of background on OraTaiao. We're a non-profit incorporated society and an advocacy group made up of health workers, health professionals, individuals, and organizations who want equity on all fronts of human, non-human, and environmental well-being. We're a Te Tiriti-based organization, and we see tiriti justice, health equity, and addressing climate change as necessarily linked. And the causal layers of climate change have roots in extractive approaches to the environment and towards people who belong to those places. And for us, this is apparent in what's occurring in Palestine, with many tens of thousands harmed, dead, likely much more, and the widespread killing, systematic targeting of healthcare and workers, widespread ecological destruction and climate damage, which is equivalent to more than a year's worth of New Zealand's emissions, are just a few aspects of the situation that link together to paint a picture of really incredible injustice. So OraTaiao is really keen to facilitate this webinar and this kōrero because we want our members and those who are not members but are here to have an opportunity to learn more about these links. And so we're really excited to have our speakers here articulate what liberation and justice means to them and add this to our collective pātaka. So thank you in advance, Ruba, Arama, and Donna, for your whakaaro, and also acknowledging Romilly, one of our OraTaiao kaimahi, for their support in organising this. So each speaker is going to have about 15 minutes to talk, and then we'll take questions through the chat at the end. And those questions will be sent to the hosts, and then we'll be speaking those questions out loud. So I will be facilitating, and we'll be aiming to finish at around 8:30. Then after the webinar, there will be a brief survey. So without further ado, I'll introduce our first speaker, Dr Ruba Harfeil. She is a GP based in in Kihikihi, and she's from Palestine originally. Romilly will paste their bios in the chat for more information. But yeah, I'll hand over to you, Ruba.
Kia ora, Summer. Kia ora, guys. Tēnā koutou katoa. Everyone, I will start by sharing my slides. Can you see this, Summer?
Yes.
All right. Kia ora, guys. My name is Ruba Harfeil. I'm a GP in rural Waipa. and I'm a Palestinian Kiwi. I moved to New Zealand in early 2013 with my husband and my daughter. She was 14 months old. Now she's 13, and I have 3 kids, and number 4 is on the way. We migrated or moved to New Zealand basically for my husband to do his PhD study at Waikato University in accounting, and for me to do my training. Today, I will be talking about the health situation in Gaza and how we as healthcare workers, regardless of who we are and what our background is, with the doctors, nurses, healthcare assistants, occupational therapists, and so, how we can help with the health crisis in Gaza. Most of the things that I'll be mentioning today or talking about today are from first-hand experience. I'll start by talking about my experience growing up in the West Bank of Palestine. So the photo on the left shows the apartheid wall. We call it the apartheid wall because it was built on a Palestinian land by the Israeli occupation forces. It is 404 meters long, was built on a Palestinian land, and it separates the Palestinian land from, or Palestinian villages from, the Israeli side. So without taking any permission, without signposting or like discussing this with the Palestinian people or with the farmers, they woke up to see one morning to see this wall separating their farms. So my granddad wasn't able to access his farms on the other side of the wall just because the wall separated his farms. So these farms on the Palestinian area are his farms, but the farms that it belongs to him, it's not for him anymore. He can't claim that these are his farms, and he can't actually access it. It's so hard to access it. And they just made it, they named it as military zone. So they've changed it from like Palestinian farms to a military zone. So Palestinians can't access it anymore. The photo on the right side is the checkpoints. These are basically made to humiliate Palestinians on a daily basis. Every time, every day you go to work from the village to the city or from one city to another, or go home after work, you have to go through at least 2 to 3 checkpoints like this. You wait on a long queue for hours, 2 to 3 hours or even more. And you wait for the Israeli soldiers who are like 18 to 19 years old with weapons on them to do body checks on you and give you the permission to go to work. So you can imagine how hard the life is to be in the West Bank. This is your land. This is where this is a Palestinian land under the international law, but you can't have your freedom in your land because of these Israeli checkpoints. It is very humiliating. It is a big struggle for all Palestinians. And this is why most Palestinians would prefer to work in their villages, like simple jobs, rather than working in cities or do like their own professions, just because of this, because they have to wait 2 hours at least in the morning and then 2 hours in the afternoon after work. The situation for kids and children of Palestine is even worse. They can be playing off the street together and they can simply be attacked by Israeli soldiers just out of the blue. They can get arrested, they can be shot dead or get shot dead, or they just humiliate kids and make them feel insecure or unsafe. And this is on a daily basis. And you can imagine your primary school child going to school every day and having to go through, to be attacked, having to face these Israeli soldiers every day on a daily basis. For high school students or university students, it's even worse because they have to go through the checkpoints, and some of them prefer not to go to school. So just because of these checkpoints and Israeli soldiers' attacks on them. Every year, 500 to 700 children gets prosecuted and arrested by the Israeli military court, which never happens in any other countries for children to be arrested and prosecuted by a military court. And today, because we're talking about our role as healthcare workers in Gaza, I thought I would just talk briefly about, like, give you some background about Gaza Strip. Gaza Strip has been under the Israeli, I would call it open air prison or blockade, under the Israeli blockade for the last 17 years, which means they can't get out of Gaza Strip or get to Gaza Strip without the Israeli permission. They can't study wherever they are, or like overseas, they can't get health, like go overseas to for health without the Israeli permission. Gaza Strip is 365 square kilometers, and it has 2.3 million people live in it. So you can imagine it's the size of Invercargill. So you can imagine the population of Auckland live in Invercargill. This is how crowded it is. It's the most densely populated area in the whole world. The unemployment rate in Gaza is massive. It's like, it says here 45%, but as per the new statistics, it's like around 65 to 70%. Over the last 17 years, since the Israeli blockade on Gaza Strip, Israel launched 5 military wars on Gaza. The first one was in 2008, and then 2012, 2014, 2021, and then the latest one in October 2023. So for someone who is 20 years old or 21 years old, they've witnessed 5 wars during their lifetime. What's happening in Gaza at the moment since October the 7th, over the last 8 months and a half, is a humanitarian crisis, really. This has never happened in the recent history. It's the worst in the recent history. This is a report done by the Euromed Human Rights Monitor from the 7th of October until the 13th of May. The Israeli occupation forces killed 45,200 people, Palestinian people. 70% of them are children and women. So they've killed around 16,000 children and 10,000 women in 8 months. They've injured 86,000 people, and 18,000 children are orphaned, which means they either lost one parent or 2 parents. A lot of them lost 2 parents. The Israeli occupation forces destroyed 80% of the infrastructure of Gaza Strips over the last 8 months and a half. The health situation in Gaza is a health crisis, the worst in the recent history, and the international community never allowed something similar to happen, except in Gaza. They don't care, apparently. So in Gaza Strip, there are 36 hospitals. The Israeli army managed to destroy all these hospitals. There are only 4 hospitals that are working as they're providing primary health service. It's like a medical center here in New Zealand, or urgent care clinic rather than a hospital. But they destroyed all these 36 hospitals. So at the moment in Gaza, there are no working hospitals, but there are some ED rooms in some of these hospitals, especially in the south, in Rafah, that is still providing some primary health services, which is not enough when you are under Israeli or like under airstrikes or bombs. You can imagine the injuries and the traumas that you would see in these ED rooms. But unfortunately, they don't have the ability to help or do surgeries for these people. Most of the surgeries that are being done at the moment are they get done through the field hospitals that the international medical missions built, mainly in the south, which is very sad, really. And we've all heard about the Al-Shifa Hospital and Nasser Hospital, and how the Israeli forces destroyed them, completely destroyed them. 500 healthcare workers were killed so far, and 550 healthcare workers got injured. 320 healthcare workers have been arrested, and 221 ambulances are destroyed. 72 medical centers have been destroyed. We all know under the international law, hospitals are protected. All hospitals, facilities, all health care facilities are protected under the international humanitarian law. The photo on the right is Al-Shifa Hospital. Al-Shifa Hospital is the only tertiary hospital in Gaza, similar to, slightly larger than Waikato Hospital. So it's it is big, it's massive. It was built in 1946, or 45 or 46, so before Israel was established. But unfortunately, it got completely destroyed. The other two photos are of the Al-Nasser Hospital, and it's the same. It is not as big as Al-Shifa Hospital. It's the largest secondary hospital in Khan Yunis, so it's in the southern part of Gaza. Al-Shifa Hospital is in the northern Gaza. Both of them were completely destroyed. Al-Shifa Hospital was the main training hospital for medical students and registrars, but it's not there anymore. And I'm not sure after the war how the registrars and medical students will continue their training. There is a systematic targeting process against the physicians and surgeons and healthcare workers in Gaza. And when we talk about the doctors and healthcare workers in Gaza, we can't really not talk about Dr. Adnan Al-Barsh. He was the head of the orthopedics department at Al-Shifa Hospital. He got arrested in December last year, and then he was tortured to death in one of the Israeli prisons. Let's watch this together.
خرجنا من المستشفى بغصة ولكن الحمد لله الحمد لله لنا رسالة والله إنك لنا رسالة وأجرنا على الله.
It's a big loss for the Gaza Strip and for all the health system in Gaza and Palestine, really, to having to lose Dr. Adnan Barsh with his massive experience. It's not only him. The general director of Shifa Hospital, Dr. Muhammad Abu Salmiya, has been in the Israeli prisons since November last year. This is the last time I was in contact with him. He's a friend of mine, and we were texting, like he was texting all the time just to give me updates about what's happening at Shifa Hospital, and then he got arrested. We don't know whether he's still there or not. We didn't hear anything about him since then. But one of the prisoners who got released in January told us or mentioned that Dr. Mohammed Abu Salmiya is not allowed to walk. He can walk using his arms and legs like an animal. He can't walk on his legs. They put a collar and a leash on his neck, and whenever he wants to do anything, they move him like a dog with the leash. He's only allowed one meal per day. So this is how they target the healthcare workers in Gaza. And when we talk about the 86,000 Palestinians who were injured in Gaza, it's not like simple injuries. It's not like a simple wound that needs few stitches. It's completely different. These are examples of injuries that happen for our kids and young people in Gaza. Kids without legs or even without arms and legs. Kids with 70% burns to their faces and bodies. And I'm sure you guys, as healthcare workers, you would imagine the pain, the physical harm and the mental harm that these young people have to endure and face because of this. Three atrocities, 3 massacres in less than 10 days. I'm sure everyone heard of them. The massacre at one of the UNRWA schools that killed 45 people. And the massacre at the in Rafah, one of the Rafah camps, where they burned people alive, and that ended up killing around 50 people. And then the last one is when they rescued the Israeli forces, occupation forces rescued 4 Israeli hostages, and that led to the killing of 274 Palestinians and injuring of around 800 Palestinians. What things that we could do to help with the current situation as healthcare workers, not only for surgeons? It's just, I think I used this slide when I gave a speech at the Australasian Surgeon College. So responsible healthcare workers and global health. There are 2 things that we have to remember here. The first thing is that we can't be silent. We can't be neutral when it comes to genocide that is unfolding in front of our eyes. We can't be neutral. You can't say, it's too complicated. This has been there for so many years and I'm not sure what to do and I can't say anything about it. We can't be neutral because this is a healthcare crisis. As a healthcare worker, you are committed to global health. We should and we must do something about it. This is the first thing. And the second thing is silence is complicity. We can't be silent. If we are silent, we are complicit in the genocide. We can all talk to our colleges, medical institutions, unions to do something about it. They can start field hospitals, they can donate medical equipment, and they can send medical missions. So these are 3 things that all of us, occupational therapists, physiotherapists, dietitians, nurses, doctors, we can put pressure on our medical organizations to do one of these 3 things. PANSMA, which is the Palestinian, Australian, New Zealand Medical Association. It's based in, so I'm both me and Mais, who's a dietitian or a speech therapist in Wellington. Both of us are in charge of PANSMA in New Zealand, and they're basically mainly working in Australia. They are sending medical missions. So whoever wants, any one of you guys who wants to join their medical missions, they can contact them, pasma.org, and they are doing a medical equipment campaign that we are going to do under the Palestine Aotearoa Healthcare Workers for Palestine group. So you can either join PASMA for the medical mission, or join any other organization that is sending medical missions to Gaza. If you want to be part of the medical equipment campaign, you can also go to their website and join them. The Fajr Scientific Organization, this is a successful example of how surgeons can make a massive impact on the global health. So Fajr Scientific started in 2019, started by surgeons, and they've been sending medical missions to like everywhere to help with health crisis, wherever it's needed. You can contact this email address if you want to join their medical missions. They accept surgeons, internal medicine physicians, general practitioners, emergency nurses, ICU doctors, intensivists, rehab, occupational therapists, and physiotherapists. And these are some of the dates for their upcoming missions. The one in April already gone, May gone. There's one in June and one in July. And I'm sure there is some more updates. I didn't get the latest dates for the missions. This is our main group in New Zealand, Aotearoa Healthcare Workers for Palestine. We are arranging weekly rallies and vigils. We're contacting medical institutions, and we are working now basically on two things: the medical equipment campaign that we will advertise for in the next couple of weeks, and the second one is the a letter to pharma to boycott the Israeli medications and provide alternative for Israeli medications. Gaza telehealth. This is something that I've joined since the start, almost the start of the war. On the 17th of October, we started Gaza telehealth. And this is a telehealth service that we can, it would allow us to provide health consults, like video or phone consults to patients in Gaza. And we cooperated, or we contacted UNRWA Health Service in Gaza. So we can see the patients, give them a prescription, like a soft copy prescription, and they can take it to any UNRWA medical centers and get their medications without them being or having to be seen by the doctors in Gaza. We are 3,000 doctors from all over the world with nurses and pharmacists. So far, we've treated more than 2,000 patients, and we have a pharmacy team on site. So whenever we have shortages of medications at the UNRWA medical centers, these pharmacists will go to private pharmacies and buy the medications and drop them off to the patient's house. Basically, most of us are doctors and nurses, are Arabic-speaking doctors and nurses and pharmacists, just to make it easier to communicate with the Gazans. So unfortunately, it's made basically for Arabic-speaking doctors or healthcare workers, but we have a subgroup on our group for non-Arabic-speaking doctors who can provide some consultations for other healthcare worker or healthcare providers. I personally managed to see around 130 patients or 140 patients so far. Lots of heartbreaking cases, especially when it comes to hepatitis, with people who have already health issues like diabetes or like complex heart problems. They don't do well with hepatitis A, which is a pandemic at the moment. There's one particular case that is like broke my heart, literally. I cried for weeks. She's a 21-year-old lady with type 1 diabetes. I talked to her about, she booked an appointment for us to provide her with insulin. This is around the time where Israel did not allow a tank or a container full of insulin, did not allow it into Gaza Strip for 3 weeks. So 3 weeks of no insulin in Gaza. And we all know that type 1 diabetes patients can't live without their insulin. Unlike type 2 diabetes, they can have like tablets or any sorts of medications to help them. But with type 1 diabetes patients, they can't live without insulin. So this lady lived for 2 weeks without insulin, and then she died. And I would like to end here by talking about how the indigenous communities are standing together in our struggles. It's the same struggle, different colonizers, but the same struggle. And we're going to stand united together to get our freedom. This is from Malcolm X. The ethnic cleansing in Palestine is a reminder of colonialism, brutal consequences, and the displacement of indigenous people. It emphasizes that the fight for justice is universal and that we must stand united with oppressed people, whether in Palestine, Aotearoa, New Zealand, Ukraine, Australia, or anywhere around the world. Ngā mihi. Free Palestine.
Kia ora, Ruba. Thank you very much for your talk. I think you really clearly demonstrated how the rights of Palestinians at every level are being denied, as well as the targeting of healthcare workers. And your aroha, your love for people in Palestine is really clear. I also imagine that there's quite a burden on you, so I hope that you're doing okay with you and your whānau. So thank you for being so open tonight. I think we'll take questions for everyone at the end, so there'll be an opportunity then. So hold on to those. Thank you, Ruba. I'll now move on to our next speaker, who is Dr. Donna Cormack. Donna is a researcher based at Te Kupinga Hauora with a focus on data sovereignty, racism, data harms, and transformative and anti-colonial approaches to Indigenous health. Kia ora, Donna.
Kia ora koutou. Tēnei te mihi aroha, kia koutou, ko huhi mai I rungi te kaupapa o te pōnei. He mihi hoki kia rātou ko wihi atu ki te pō, ki ngā whānau pani e noho tonu ana I te kapua pauri. Rātou kia rātou tātou, kia tātou tēnā no tātou katoa. So kia ora and thank you for having me. I'm grateful to be here to share space with Ruba and with Arama, not physically together, but together in collective Indigenous resistance and refusal and in a commitment to a radical otherwise where Palestine is free. And I'm here today as part of Māori Doctors in Solidarity. We're a collective, a loose collective, and although we're called Māori Doctors in Solidarity, our collective has Māori medical doctors, Māori medical students, Māori health academics and researchers like myself, and we're part of this broader global Indigenous health community. And I think I'm picking up a little bit where Ruba left around some thoughts on solidarity and some of the writing and theorizing that I've found helpful in the face of the brutal violence and genocide that's the ongoing manifestation of colonialism in Palestine. And so I wanted to talk a little bit about solidarity with Palestine for us working in health, whether we're health workers or teachers or researchers, and in relation to 3 concepts. Some people might have heard me talk about some of these before. So Sara Ahmed's concept of non-performativity, the idea of solidarity as a refusal, and solidarity as a radical interdependence. So I think that one of the things that we can see, and Ruba talked about this as well in her talk, in this current moment, we can see with clarity non-performativity, which is using Sara Ahmed's term to talk about the way that a lot of colleges, medical colleges, health professional organisations, medical schools and universities, they make commitments and statements, frameworks and curriculum about the structural determinants of health, about equity, about Indigenous health, and about being against colonialism and racism. But this concept that Sarah Ahmed introduces around non-performativity is really about how, and what we can see really clearly in the current moment, how talking about things, so how naming something doesn't necessarily bring something into effect. And she goes further to say that institutions under colonialism might name things as if that is the action. So it's almost a way of not bringing something into being. So I find this concept really useful in terms of the current genocide in Palestine, and it draws attention to how, although claims that are made in those sorts of statements and commitments by medical colleges and health professional organisations around Indigenous rights, around the right to health, around the even most basic fundamental human right to life, don't turn into actions, or they turn into actions that, as Sarah Ahmed says, aren't followed through. So, you know, it makes me think, like, what work are these claims doing if they're not doing what they say? And what is the use of a statement or a framework about Indigenous health or colonialism if it does not actually translate from the abstract into material action? What does it mean for medical colleges, for our regulatory authorities, for universities to say they expect students, trainees, fellows to demonstrate these things as competencies, but in the moment they themselves are silent, and even worse, they're silencing of people trying to speak out on these things? And so if we understand solidarity as a practice, a way of being in the world, a commitment to relationships, then it's going to necessarily be disruptive of the current order of things. And so perhaps at one level, it's not a surprise that we see this contradiction between what health institutions or organizations say and what they actually do. And even if we see this contradiction, that doesn't mean that we shouldn't hold them to account. I do think we need to name the harm from their silences and their silencing. And we also need to question the authority that they presume to have to speak as kind of leaders on healthcare and health professional matters, when they won't speak on the killing of tens of thousands, or the systematic denial of the conditions to life, the targeted destruction of hospitals, the abduction and killing of their colleagues. So the leadership will not come from there. Robin Maynard, who is an amazing scholar from Canada, in a speech at the November for Free Palestine National Day of Action in November last year, said, "We do not turn to look upward." She was talking about sort of the complicity of the governments, and she said, "We don't turn to look upward at states to tell us what is just, but we need to look around us, and we turn to the people around us, and we choose to defend and protect life." And so that's sort of the second concept I wanted to cover, is also solidarity, and solidarity in particular is refusal. So when we refuse things, that in itself can be an act of solidarity. We can refuse to participate in the activities that our institutions want us to do, or the ones that we want to do because we'd normally be rewarded for them. We can refuse to stand, we can refuse to sit, we can refuse to be quiet. But also, I think in this moment, in the face of violence, the violence of colonialism and racism, solidarity is in and of itself an act of refusal. Sandy Grande, who's a scholar, a Native scholar, she talks about the importance of us committing to collectivity, and that part of that is a refusal of the individualistic promise project, this is her quote, of the settler state and all of its institutions, so that we have to, I guess this makes me think about how solidarity as an expression of our collectivity, of our commitment to each other, is a refusal, and it's a refusal of that idea of us as neoliberal individuals. It refuses borders. It refuses the notions of scarcity that position our struggles as if they're in competition for some finite resource of justice. And so collective struggle and collective resistance and collective dreaming are threatening because they offer an alternative vision and way of being to that which colonialism is trying to tell us is inevitable. And it's powerful. Collectivism is powerful and sustaining, which is why colonialism works so hard to try to break it down. And so finally, I wanted to just touch a little bit on the idea of solidarity as interdependence. And here I really like the words of Ruth Wilson Gilmore. So she's a Marxist abolitionist scholar. And so she talks about this concept of radical dependency. And I really like what she says about solidarity. She says it's not something that is, it's something that we do. It's something that's made and remade and remade. It never just is. And I think of that in terms of radical dependency, that we come absolutely to depend on each other. And so I just wanted to, mine has not been 15 minutes, but I thought I just really wanted to, I guess, offer a few thoughts about solidarity and the role that we can play as people who have a deep commitment to Indigenous health and an understanding of colonialism and racism as structural determinants in this current moment. And so I'll just close, I think, with some words from another member of our collective, Jax Aramoana, who I think is on the call, about solidarity not being out of self-interest. So she says, even if we never need specific help, we surely know that dismantling any system of domination and dispossession globally makes those systems weaker everywhere. And we surely have an appetite for justice beyond that of our own. We have a vision for thriving futures for mokopuna other than our own, knowing that this planet, this entire world, the future of all of us depends on the end of colonialism. Because if we can't do that, if we can't have both, we can't have rangatiratanga. We can't have rangatiratanga if we don't have a planet. So I think what we can do as healthcare workers in this moment is to make and remake those solidarities and to commit and recommit until Palestine is free, because a world where we're in good relation with our environment and our human relations and our other human relations requires that Palestine is free. So that's just what I wanted to offer to tonight. So thank you for the space and time to share. Kia ora.
Kia ora hoki, Donna. Ngā mihi nui mō tō kōrero. I found that really powerful and interesting, especially when you described solidarity as a commitment to relationships and how actions that foster that is what we should be looking to do. I also thought when you said justice is not a finite resource, that's really powerful as well, especially in Aotearoa, where sometimes people might say, oh, we need to focus on environmental justice. Like, what do you mean social justice? But if we understand it as not finite, then maybe we can, link those causes together. So thank you very much for your thoughts and for contributing to this space. Kia ora, Donna. So now we're moving to our final speaker, Dr Arama Rata, who belongs to Ngā Ruahine Taranaki and Ngāti Maniapoto. She's also a researcher, co-director of Te Kuaka, a research and advocacy group that promotes independent, progressive foreign policy for Aotearoa, New Zealand. And she also has a focus on anti-racism, anti-imperialism, and liberatory pedagogies. Kia ora, Arama.
Tēnā koutou. Thank you for the opportunity to be in conversation with you all tonight. As you mentioned, I'm a researcher. I have done some work in health research, but that's not, I guess, the sole focus of my research. And I think I'll probably be coming at the kōrero tonight, probably based more on some of the work I've been doing in activism around the international movement for Palestinian liberation. So since the onset of the genocide, we've been involved, we've created a group called Matika Mō Paratinia, which is like a Māori group. that is in solidarity with Palestine. And we've also been working with a group called Kaiawhina Tamaki, which is a group of marshals, and there are some of our crew on the Zui tonight. Big ups to Tamaki Street Medics, who have been at all of the protests, taking care of our whānau who to ensure the health of people on the street. Recently, we had the opportunity to attend some events in the US. So we went to Dartmouth College, which is a Ivy League college, and the students there had, if you imagine, it's like the most idyllic campus. It's like Gilmore Girls. It's so tranquil that I'm sure Donna would be in agreement with me that when you see a place that tranquil, you can't help but notice the absence of violence and wonder where that violence is and what violence is placed elsewhere that allows this level of relative safety to occur. And despite the tranquil setting, the week prior, the students had set up an encampment, and their university president had responded by calling in state troopers, had called in SWAT teams. 90 of the students were arrested and hauled off in buses that the university president had provided. So their own university buses that usually take them on field trips and things like this were used to very violently arrest student and staff and remove them from their campus. And following that, it was just a great opportunity to be able to sit with these students who, and many of them just attended in support of Palestine and had no idea about the level of violence that they would be faced with for participating in that. And so many of them were unaware of the place that they had taken in history and how historic their action had been. So it was nice to come in as an outsider and be able to reflect back the importance of the work that they were doing. And part of the reason that it's so important is because of the role that these institutions play. So we know that the struggle for the armed resistance that's taking place in Palestine has changed the world. This has opened so many possibilities for a new geopolitical order, for liberation of colonized peoples around the world. It has pierced holes in all of the myths about the military and moral superiority of US and Palestine. It has stripped away all of the facade about Israel being a democracy, and has really shown the world it's a real mask-off moment. So the violence of the Israeli regime has been exposed, and the inadequacy of international law, of our international institutions at providing justice has been exposed. And we know that when it comes to the violence of colonialism and imperialism, that, many people often talk about Palestine as being the battlefront or the tip of the spear in terms of the industrialized violence that's taking place on this incredibly small piece of land. And I listened to a kōrero from Fred Moten, and some of his words I thought were really important. And he said that while this is true, while that is the tip of the spear in terms of colonial violence, we cannot allow the Palestinian struggle to stand in for our own. And so we cannot just stand behind that battlefront and say that we're in support of it. What is required of us, what is our revolutionary duty in this moment in history, is to open a front up wherever it is that we are placed to take on that struggle. So not just be in solidarity, but be in joint struggle, understanding the connections between our struggles. And so for this moment in history where we're seeing the decline of US hegemony and the kind of Western world order, we're seeing the decline in terms of the productive capacity of the West. So they've been overtaken in terms of production. Their economic kind of stranglehold over the world is being challenged. Their moral superiority has been completely exposed as being false, but they still have a stranglehold over the world and are able to use this violence because they still are supreme when it comes to military power and also cultural power. And by cultural power, I'm talking about their power to define what is the truth. And so when we see these students setting up these encampments, demanding that their institutions divest from Israeli corporations, the battle is not really over whether or not that money goes to Israel. That's not really the significance of what they're doing. It's the fact that these institutions, which are the epitome of knowledge production within the imperial core, are having to confront their students redefining what they would like to say is the truth. So calling this a genocide. Having these knowledge producing institutions stand up in opposition to genocide, in opposition to the settler colonial project of Israel. And when it comes to and that's why we see such violent repression from the state when those students do that type of work. When it comes to healthcare workers, there's like not only this kind of practical support that is available to people within the sector that Ruba was outlining for us, that practical help in terms of the health line or the missions to Gaza, but also the one area that healthcare workers are so important in this struggle is the place that healthcare workers hold in terms of the moral argument, so that healthcare workers are seen as being leaders in terms of their moral positioning. And so when we see these amazing protests that have been happening, led by Donna and some others on this call, they're extremely powerful in terms of the narrative that provides, the moral clarity that provides on this issue. And that kind of takes us through those different kind of battlefronts. Here in Aotearoa, we've seen that the most vocal opposition to the genocide has come from Te Pāti Māori when we look at the political sphere. And so, and there has been, although there have been attempts by Israel to, by the kind of Israeli propaganda machine to discredit Indigenous voices that are standing up against Israel, we see that as another kind of area where a lot of the narrative war is being fought in terms of naming Zionism as a settler colonial project, showing that when Donna talks about all of that non-performativity that has been going on for so long, although that hasn't led to Māori liberation or decolonization here in Aotearoa, it has contributed to a widespread understanding that decolonization is supposedly good. And so by calling Zionism a settler colonial project, we see that there's a lot of kind of narrative power in that. And it's because of the power of the position of healthcare workers, of Indigenous intellectuals, that we actually see the Israeli propaganda machine, the Zionist propaganda machine, targeting those healthcare workers, those Indigenous scholars, through trying to create punishments for those who speak out in those spaces. And we're seeing them do that, for example, through the Human Rights Commission. So making complaints to the Human Rights Commission, accusing our Māori scholars and our health scholars in the health sector and healthcare workers of anti-Semitism. And we can often see where the weak points are, because that's where they will attack us. I've heard about the way in which Zionist propaganda machine will separate out those who they view as people who criticize Israel versus those who delegitimize Israel. So they leave me alone because I'm just someone who criticizes Israel, but someone who delegitimizes Israel are people with that moral kind of power to do so. So healthcare workers, scholars, Indigenous scholars, human rights lawyers, these types of people. So that's just to really reiterate that although there's a risk that they try to associate with healthcare workers speaking out, it's also an incredibly powerful voice to hear healthcare workers in opposition to Israel. So all that just to kind of make sure that we're kind of clear about the power that we have in the way that we're positioning ourselves. We've also seen in Aotearoa these attempts to show Indigenous voices that are supportive of Israel. And so that's certainly been an area where we have put energy into undermining those types of narratives. And so we have Māori involved with the Indigenous embassy in Israel. And so those types of voices that would try to establish the idea that Israelis are indigenous to the area, that type of narrative is something also that we're working to attack. I think it's a very interesting time to kind of consider some of these linkages between the environment, the struggle for Indigenous liberation in Palestine, particularly given lots of events that we're seeing at the moment. So we're seeing the Kanaki resistance rising. We're seeing RIMPAC taking place, which are military exercises that that Israel and New Zealand are participating in this year, where the military exercises are so destructive, you could say, that they cause ecocide to the environments that they take place in. And the ramping up of militarism through pacts like AUKUS really threaten Pacific existence. What AUKUS is a anti-China military pact centered around the acquisition of nuclear submarines that would see the Pacific as a staging ground for a war on China. So, and then at the same time, we also have FESPAC taking place, where artists from across the Pacific have converged on Hawaii to celebrate Pacific arts. But what we see through that is that this is a cultural celebration that is sponsored by the military and is sponsored by the tourism industry, which are the two things that are most destructive to Hawaiian lands and oceans. And what we see there is this co-option of Indigenous cultural and intellectual and political leaders into a form of expression that is compatible with colonialism and imperialism and the ongoing extractivism that we see leading us to the brink of extinction. And so I guess with all of these things that are happening at home, we can see these as new kind of battlefronts, which is in some ways a good use of our energy here in Aotearoa. So how do we support Palestine? We open a front against colonialism and imperialism here in Aotearoa. understanding our regional connections, so that we're not just standing behind Palestine, but we're actually in joint struggle with Palestine. So I think I'll just leave it there, having just brought in a few different things that are happening at the moment, which I hope has provided a little bit of clarity on some of the ways in which we can be in joint struggle with Palestinians, whether we're in health or not. And finally, I just want to mihi te Ruba, because your presentation was amazing, as was yours, Donna. What Ruba didn't present today about what she is doing is that she is a healthcare worker in Ngāti Maniapoto, Ngāti Apakura areas, serving my people. And it's just so appreciative of you doing that, and providing the type of care that I know is rare for Māori to receive in Aotearoa. And when we spoke earlier, you'd mentioned that it's the first free GP service based at a marae. And I think what that really shows is that it is completely possible for Māori to be provided with healthcare in this country, but that it is part of the system that seeks to destroy us, that seeks to expose us to premature death, that although we're at a different phase, of course, a very different phase than what we're seeing in Gaza, we do know that our people have experienced much of the same systems. So systems that have and watching what's happening play out in Gaza really brings a lot of clarity to our own experiences of colonialism that Donna referred to as well. So it shows us the violence, the absolute brutality that colonialism is always foundational to a settler colony. The way in which attacking people's health is a feature of that. It's not, we often talk about our history as though Māori died away because of disease, as though that wasn't calculated, as though dispossessing us, placing us into a position of being refugees in our own lands, depriving us of everything life-giving, the very duplicitous or perhaps Donna might say non-performative way in which settler colonial rulers, the ruling elite, will talk about the project as being humanitarian. They'll talk about the project as being a gift to the colonized people. We can see how very duplicitous that is, and the purpose that serves. The calculated way in which our health system and all of our structures are destroyed through that. And also, I think it brings clarity on the relationship between the settler colony and the imperial core. So, lots of people talk about which is the tail and which is the dog, and we see that they work hand in glove with one another, and how that kind of same dynamic was present within our own colonization here. And then we see with what happens every time there is a challenge to the settler colony is that they'll double down on their colonial violence. So they'll never betray the violence upon which the settler colony was established on. And when it is challenged, it will double down on the destruction of everything life-giving, our health institutions, our cultural institutions, our intellectual institutions. And now we're seeing that the current government thinks that a great solution at this time would be to create a mega prison. And so we see all of those things kind of brought into sharper focus in ways in which we can never forget Palestine as we struggle for our own liberation and independence, which then sets us up to be stronger allies, as we see like with the South African case, for example. Once liberation has been achieved by that people, then they then are able to have greater power on the international stage to support Palestinian liberation. And I'll end it there.
Kia ora, Arama. I think it's definitely a moment for collective mobilization against American exceptionalism, imperialism, and colonialism. And yeah, thank you for reaffirming the role of Indigenous people, Māori, and health workers in this joint struggle. And I think you really helped us to get a higher resolution of how these things are linking together. So ngā mihi nui mō tō whakaaro. Yeah, so that's all three of our speakers. I'm aware of the time, but maybe if we just take a couple of questions through the chat. So I think Romilly will send them to me and I'll read them out. So we'll see what comes up. Have we had many questions through the chat, Romilly?
Kia ora, everyone. No questions, so if anyone does have a question, feel free to send it through now. Just a comment though, incredibly powerful and emotional, all of the kōrero, thank you so much. So that's come through from Nadine. And I'll read out the messages that have come out. Ngā mihi nui to all of you speakers. My heart goes out especially to you, Ruba, with the heaviness of what is happening to your people and with you carrying a new life, being a hapu mama that shouldn't have to carry such heavy burdens. That's from Deborah.
Thank you, Deborah.
But yeah, so maybe just a lot of food for thought there. So no other questions have come through. So
Awesome. Thank you. Yeah, thanks again to you, Ruba, Donna, Arama, for coming and contributing really openly and really thoughtfully. I think we've all really appreciated the kōrero, and I certainly have a lot more to think about. I really enjoyed the quotes and the various ideas that you all shared. So yeah, thank you very much. I will send us out tonight with a karakia, and also when you leave the Zoom meeting, there will be an option to fill out a survey if you want. Yeah. So ngā mihi nui kia tātou, ka pai tō he karakia whakamutunga. Kia whakailia te tapu, kia wātea ai te ara, kia turuki whakataha ai, kia turuki whakataha ai, haumie, koe, tai kie.